it's Dr. Whitney, and I'm going to do 0 to 3 months education to help support your baby's spine. So one of the first things that I see so commonly is that there's improper head support in the car seats, especially if your baby already is having to want to tilt to one side or hold their head one way. When they receive their care, we want to make sure it's well supported. So with baby Ian, you'll see here, this is one of the car seats that has very good support. His head's firmly supported on both sides, and it's not allowed to tip one way or the other. But most commonly what I see those smaller heads and much more room in between the car seat and the head, so the head tips. So here's the tip I want to give you, is you can take a receiving blanket, a burp cloth, and you can simply roll it up. If it's bigger, you can even rubber band it around. And then what you'll do is you'll place it on the outsides. You can place it on both sides or just one side if the head's tipping one way. Because if you think about if you're in the car 15 minutes, 30 minutes, an hour a day, twice a day, it's the third baby, you're on the go a lot, think how much that head is in the wrong position or could be in the wrong position. So you want to properly support it in the car seat. Second, what I want to show you with baby Ian here is I want to show you a stretch that you can do daily. You can do this 1 to 2 times a day, and it's very, very good for the spine. So I'm just going to pull Ian out here. So when you do this, you can just take your little one, you can have a seat, and what you'll do is you'll hold the back of the head right underneath, and you're going to hold right underneath the bum here. And what you're going to do is you're going to make a C-shape stretch with the body. You're going to take it to the side, and you're going to hold it for about 5 seconds. And then you're going to take it to the other side. You're stretching the whole spinal column and the head, and you're going to hold it for 5 seconds. You can do this as long as your baby's comfortable, not irritable, and will allow you to do it. So sometimes after a bath, or after they've eaten and burped, it's a nice time. So again, stretching the whole spinal column. And the other 3 tips I want to give you relates actually back to the car seat. So if you think about babies in a sitting position, then you add in carriers, then you add in swings, bouncy seats. There's a constant time when that baby's spine is not able to move and start to get strength. So all I want you to think about is your time units that they're using those. So ideally, other than driving in the car, 10 to 15 increments in the seats or in the swings or in the bouncy seats. Because what we want is as early as 6 weeks is we want to start promoting tummy time. So just for a few minutes a day at 6 weeks, you can start with that, putting them on their tummy, gaining head and neck strength. You can even take your infant if they're not ready for tummy time yet, and you can just simply hold them in this position so they are supported yet over your lap. And as you can see Ian here already just arching the neck back and starting to strengthen those muscles. By 3 months, ideal is an hour a day. You can break that up into 10-minute increments. And then finally what I want to show you is infant carrying. So some of the carriers that we have for infants, put them in the front position and then let the hips dangle out. Some of the problems with that, though, is it places a lot of stress into the hip sockets here. So ideally, and I've given you a link, is you want to use more fabric types of carriers like Moby wraps, ring slings, papooses, anything that puts the hips more into an upright frog leg position. It's more comfortable and it's better for hip development. So those are your 5 tips for caring for your baby 0 to 3 months.